you being so influential in how I treat selective mutism, and it's a small group of people, and that's a wonderful group to be a part of. But yeah, I came to this as you did, as a young psychologist, and my son was trilingual. We moved from Argentina to Israel. He spoke Hebrew, English, and Spanish, and he was a very chatty boy at home, and he stopped talking when he went to kindergarten. And this was in 1990. There were still dinosaurs on the roaming the country in those days. And selective mutism just was not a known entity. So and I intuitively then, I got all of these wrong diagnoses, very alarming, very upsetting. And I knew who my son was. And so just intuitively, I realized that the way to help him is this bridge from home to school, to kindergarten, and to help him bring himself from home to the kindergarten. And so I went into the kindergarten, my husband went into the kindergarten, and we tried to educate the teachers, even though we didn't really know what we were doing particularly, but it was very intuitive. And it remains really the essence of my feeling of how to treat selective mutism, that bridge from home to school. And as you said, it's my passion, it's your passion, it's really in our veins, isn't it? It's just our life's work.
I mean, it really is. It's beyond, like, when people say things like, your work, or when are you going to retire, or, I'm like, wait, I love what I do, and things are changing, and things are evolving, but I still love what I do. I'm still passionate about this topic. I'm still always wanting to write and speak to people. And I feel like when you were speaking, it could have been me, with my daughter, because as a physician, I was taught to treat the person, not a symptom. That's what I went to med school. That was the first thing we learned about. Like, you have a fever, you have a fever. Why do you have a fever? So that has been the hallmark. And then learning, you brought up the bridge from home to school, the bridge from home to restaurants and stores, wherever it might be, but also the social communication bridge for us, because I feel like anyone that focuses just on talking without understanding this child and who they are and why they may not be talking, to me, are missing the boat.
Yeah.
And so I love your work. I love that we both have, I think anyone that's successful with this population has to have similarities. The words we use to describe it may be different. How we come about it initially may sound a bit different, but there's so many similarities. And when I do these podcasts with different experts and different people in the field, there's so many similarities, but yet there's differences. And I think some treatments are a little bit more effective for some, and others. I will say that when you see it as from a person standpoint, like you said, I think you hit almost all populations of SM, because not all children are timid. Not all children just need to be exposed to verbalization. It's understanding why they're not. And I love, love, love when you talk about why the clinic isn't enough. And that is one of the hallmarks of what we tell families. Like, yeah, you can come and bring your child, or we can do telehealth, but it's what we learn, right? Experts in those sessions
Right.
that then guide you out of the sessions.
Right. I think that the two gestures that can kind of summarize treating selective mutism, and I agree, there's so much similarity between how different practitioners are working with selective mutism, because it works, because that is evidence-based, that works. But I think there's the integrative, there's the parents, teachers, therapist, or key worker, and getting the teachers to help, getting the parents to help. And then there's the bridge from home to school, the social communications bridge. But I think that in order to help a child, being in the clinic is just not enough, because that is the essence of selective mutism. A child will talk in the clinic, a child will be chatty and involved in the clinic, and then you go to school, or you go to grandparents, or you go to the store, and and he or she is not going to talk. So that is why working in the clinic alone, without either feelers out training, working in conjunction with teachers and with parents, or going into the school, which is what I love to do the best, just isn't enough. And, I'm sure that you, like me, every day get clients who come in and say, yeah, we've been to psychotherapy for 4 years. Sometimes you
Yep.
get teens who've been to so many
Oh,
different kinds of therapy, and none of them have taken it out of the setting. And that's
100%.
not acceptable.
That is 100%. I would say on a daily basis, we receive calls from families, and at least one or two of them say, and I'd say the far majority is yes, my child was in the clinic, eventually spoke to the clinician, which in my opinion shouldn't take that long, but sometimes it does. But they weren't given strategies, interventions, accountable goals. Sometimes you can see it as homework. I see it as helping you unlearn a conditioned behavior, knowing what to do, but these accountable kind of take home goals where they write it in, they know they either on their phone or on a hard copy where they are unlearning. And we're going to talk about that bridge a bit because
Mhm.
for us, it's like, okay, you do this at home, you transition, whatever that skill may be into that environment and you see where can they achieve it. And that's your starting point. So if
Right.
they can achieve it alone with the parent in the school, the verbalization with the right accommodations and the right skills,
Mhm.
because I do wanna say, one of the things I think that stands out, and I wanna and as we talk about this moving it, I do wanna ask you, so for these children that have speech and language issues, are on the autism spectrum, I'm amazed how many kids we see with ASD, with
Mhm.
neurodivergence, that have
Mhm.
ADHD, that have processing issues, that have sensory processing. Wouldn't you agree you have to understand those kids in order to adapt the treatment?
You absolutely do. And my original research, which was 25 years ago, no, it was 20 years ago, apologies, I divided in a very rough way between children who have simple SM, which is it's a phobia of speech, which might be because of their disposition. Obviously, always nature and nurture, what I've been through in life, what kind of kindergarten, perhaps geographical moves, perhaps language difficulties. And then there are children who have so many different comorbidities or
Yep.
acomorbidity, but in all of these cases, I advocate for treating selective mutism because so that the child can have access to the help that they need in whatever else is going on in their life. But I think one of the important points is that you've got to see each child as his unique person with his strength, with his challenges, with whatever comorbidities there may be, and adjust, fine tune the treatment in order to fit the individual child, and
I
never
love it. I
consider it
wish
a cookbook. Never, never.
I I love that. I feel like that's gonna be one of our, like, statements on our YouTube is, like, you saying that because if I had a glass of wine, and it's a little early here to have a glass of wine or a glass of champagne, because I truly do love seeing you, and I remember talking to Brandon going, "You have to reach out to Ruth," is that clinking of it, because that is exactly right. Every child is unique. Every family is unique because
Absolutely.
integrating the family, every school system has
Absolutely.
their right? And it's about really understanding that. And I don't get the come on in, let's get you to talk attitude, because to me, you're missing the boat. And so for us, we do the selective mutism eval that starts to really see what is this individual's individuality.
Exactly. And one of the beautiful things about the integrative treatment is that you get to know the parents, you get to know the teacher. You're not seeing, whether you're going to the school or not, you're not seeing the child kind of in a separate from everything else that goes on in his life. And you can never understand a child when you take them separately from their family, from their school, from their culture. So it is so important to have all of that in mind.
So that's another thing. So the first thing we talked about is taking it from the clinic and out. And that's with accountable goals, hard copies, knowing what, when, and where, how to do it, training the parents. Just a day ago, we got a message from a family. I forget exactly where they live. It was out west. And she said, we've been in treatment for 2 years and we loved our therapist, but honestly, he's made minimal progress, but he's talking to her and all the office staff, but I've never been taught what to do. And so I leave that session. where I'm usually in the waiting area with my child, and I leave, come back the following week, and I don't know what to do outside that office. And
Mhm.
I'm like, well, my staff, but that is what needs to be done. So we certainly can work with you. We can educate your therapist, but you've got to take what they know works out and about into that world and to train you. Just
Mhm.
even how they talk to their children, right? The can you, will you
Mhm.
need to, you should language. We need to help them be more direct and positive and upbeat. And how do you bring them into social communication? So you practice that in the office with
Mhm.
the parents, with
Mhm.
the child, and then you go out and you work on it in the way the clinician recommends. So what
Right.
are your thoughts on that?
So absolutely, the parents have to be trained, the teachers have to be trained. It's a combination of materials and videos, but there is no way to do it without. I mean, some parents do, but on the whole, to do it without the connection with somebody who really understands and can help the parents learn how to speak to their child, how to do exposure in the school with grandparents outside their home, inside their home if children don't talk when they have visitors. So it's vital, and you know what I feel is a really good recipe for success. Firstly, the integrative treatment, but also the training parents, having them learn, having teachers learn, and key workers learn, but then ongoing guidance. It usually isn't enough to explain, to you put the whole program in front of a parent and say, okay, this is what's going to happen and this is what's going to happen next. And it never works out as you imagine. It might work out better, it might take longer. You may have to change the direction in some way, but it's that is really a good combination to have the training, to have the learning, how to speak to the child, how to do exposures, how to talk to the school, and then having that ongoing guidance.